Representative Ralph Abrams is with us, Republican from the great state of Louisiana. Congressman, welcome to the program. We understand that New Orleans is now an epicenter and certainly a hot spot. Do you wish maybe that Mardi Gras had been canceled?
Look, it certainly contributed, it looks like, to the spread of the virus. Decisions were made on the knowledge at that time, and, it was a tough call, but New Orleans is definitely a hot spot now, Stuart.
What do you make of that scene that we just saw on the floor of the House of Representatives? An impassioned and emotional appeal about we're not obeying these social distancing rules. And we've got the whole point about whether we get a voice vote or not and the delay. What's going on in Congress, sir?
Well, I think it was a little bit over the top. The president and the vice president, they've been aggressive, they've been logical in their approach to combating coronavirus. They've done a wonderful job, and they have prevented deaths and they have prevented spread. So we need to take a step back, understand that this is both an airborne and a surface-borne virus, that we are developing drugs. We have some drugs in the experimental stage, such as the hydroxychloroquine, that is working. And we need to be allowed to use those drugs as clinicians and as doctors on the front line.
Well, you're a doctor. You left D.C. to go back to your state where you are treating patients. Are you allowed to treat with this drug, hydrochloroquine?
The rules now, Stuart, are that we can use this drug only in severe hospitalized patients. And that's good, but we have to get permission. Now, we, are the doctor. There's a bill in effect now called the Right to Try bill, which was passed a couple of years ago in the hopes of allowing cancer patients to use experimental drugs as the last resort. This hydroxychloroquine should be exactly used like that. It should be a decision between the patient or the patient's family and the doctor. I've talked to colleagues in Seattle, in New York, in New Orleans, literally everywhere in the nation that I could get to them that have used this drug, and in most cases, not all, but in most cases, it's having some great success.
Other than that, Congressman, are you having trouble with medical equipment and medical supplies?
Well, we're having problems getting the protective equipment that is needed for the hospitals. That is getting better. Again, I go back to President Trump and Vice President Pence's aggressiveness in treating and combating this issue. They've allowed companies that would normally not make these types of products, allow them to do this. And now we're seeing more of it come to the market, come to the hospitals, and come to where we need it in the clinics.
In the clinics and the hospitals that you've seen in your area, have you seen, are they overwhelmed?
In my area, no. They are busy, but they're not overwhelmed. Now, that, somewhat different. I've talked to physicians in the New Orleans area, and they are really stressed down there in some of those hospitals. But where I am helping out in the clinic in rural northeast Louisiana, we're busy, but we're not overwhelmed.
All right, Congressman Ralph Abrams, we appreciate you being with us today. Very difficult circumstances, but thank you for being here, sir. Appreciate it.